Welcome to those who are just starting to join. We're going to get started in a couple of minutes, but wanted to give you all a chance to join us and say hello in the chat and settle in.
Right. Thank you, everybody, for joining. Right now, we're just waiting on 2 more sessions to end. So if you are here, if you could, in the chat, let us know which session you attended and what you took away from it. We're just going to wait for the rest of everyone to join so we can close out the 2024 Family Voices Health Summit. Thank you. All right, we're getting more people coming back, which is great. Again, if you're just joining us for the ending session of our summit, let us know what you came for. Let us know where you ended up. What sessions did you go to? What did you learn? Was there good engagement? Or any thoughts about the summit while we're waiting for everybody to come back? Right, we're getting there. 76 people back. I know we have a couple more than that. Getting some great comments in here, and thank you so much to everyone. I'm glad you enjoyed the transition. Legislative advocacy, there we go. Fantastic. Donnell, thank you very much. Wish I could have seen you, but it was a pleasure seeing you last year. Thank you very much, Jessica. Beatrice, I'm glad the IHSS session is extremely important, and I'm glad it answered your questions. There we go. Lots of wonderful information. That's what we like to hear. Just waiting, I think, for one more session to end itself. And then we'll go ahead and we will officially do our closing statements for the summit.
And we will have interpretation started in just a moment. Maria, can you check? Thank you.
Good, the adult transition is fantastic. Dental care, absolutely. We talked a lot about dental care today. We were so glad that Dr. Glassman could join us to talk about it directly. All right, looks like we have 86 people back. Do we have any other groups that are still live? And Stacy, I agree with you. I wish I could have attended all the sessions, and I did for about 5 minutes at a time. We're going to talk about where you can find them and how you can get the resources and everything like that once we do our closing statements. Yes, the recording is going to be fantastic resources. And again, you're more than welcome to look on our website because the previous year's Health Summits resources are there as well. So we did other topics that again are not clones of these. So really interesting topics, again, from really trusted partners and community-based organizations. So I would highly recommend looking at our site for the previous videos, a lot of information. Let's see, we got 88 back. Holly, are there any others that we're waiting on?
No, we are all set.
All right. Well, let's start it then. Well, everyone, thank you all for coming back. I know it's been a long 2 days and a lot of information. I am going to keep it very brief and very short. I just want to thank all of you for taking the time out of your day. I know it's extremely difficult. Some of you have children, some of you are working. There's just so many things, and to go ahead and take the time to be able to listen to these different sessions that we've had, not only shows the depth of our community, but it also shows how fantastic our community is, because we're always searching for more knowledge for our children and our community. So I appreciate it. On behalf of Family Voices of California, we hope that you enjoyed the Health Summit and that you found it a useful resource. And with that, I'm going to go ahead and turn it over to our two closing speakers. Seda, who's the Executive Director of the Family Resource Centers Network of California, and Wendy Neikirk Rhodes, who's the Executive Director of Support for Families for Children with Disabilities. Welcome, both of you.
Thank you so much, Nick. So what a fantastic way to close out the Family Voices of California Health Summit. It's truly been a remarkable event filled with insightful discussions and invaluable connections. A big thank you is definitely in order to Family Voices of California for their dedication and hard work in organizing such a meaningful summit. Their commitment to supporting families of children with disabilities and special healthcare needs is truly commendable and essential. And of course, a round of applause to all of our speakers, parents, advocates, caregivers, sponsors, and honorable assembly members who contributed their time, expertise, and passion to make this summit a success. As Executive Director of the Family Resource Centers Network of California, it's clear on how much this summit resonates with our organization's mission. Your commitment to supporting families and promoting family-friendly, and family-centered, parent-dedicated resources is inspiring. Of all the sessions provided, so many learning opportunities, and the focus on cultural competence and equity in healthcare is incredibly important, especially for children and youth with special healthcare needs. By emphasizing the impact on cultural competency and sharing strategies to advance it, this summit is helping to ensure that all families receive the care and support they need, regardless of their background or circumstances. Thank you to everyone who participated in this summit and for your dedication to improving the lives of families across California. Let's carry the momentum and insights gained from this event and looking forward to, as we continue our collective efforts to create a more inclusive and equitable healthcare system for all. Thank you.
Thank you so much for that, Anna, and for the amazing work that the FRCNCA does supporting family resource centers across the state. It's vital, and it's places where families can get connected to the support that their children need, especially through early start. So thank you so much for the work that you do.
Thank you.
I am just so inspired and thrilled to be here. The past 2 days have been packed with information. I want to start by saying thank you to Nick Lutton, the manager at Family Voices of California, and to Holly Wong and her team, who are the consultants who helped put this amazing conference together. Thank you so much to both of you. I also want to say thank you again to our sponsors and to our community, our executive council member agencies, to the Eastern Los Angeles Family Resource Center, the Family Resource Centers Network of California, the Family Alpha Resource Center. Your commitment is just amazing. And our sponsors at CalOptima Health, the Lucille Packard Foundation for Children's Health, California Children's Hospital Association, Lucille Packard Children's Hospital, Tri-Counties Regional Center, the Children's Specialty Care Coalition, Pediatric Day Healthcare Coalition, and Disability Rights California. We couldn't have done this without you. Thank you so, so much for your partnership and your support. And then finally to the planning committee. There are so many incredible stakeholders and advocates who helped to plan this conference. It truly, truly takes a village. So thank you to everyone who presented and who was part of the Planning Council, because your efforts created this amazing, amazing 2 days of connection and inspiration and education and advocacy and moving forward and learning about policy work that we have just done. And if you're like me and you're clearing next weekend to watch all the sessions that you couldn't attend, I want to make sure that you all know the videos will be available on the Family Voices website, as well as social media and YouTube by the end of next week. And Nick and Holly are working so that they will also be sending out the slides and resources from the sessions. So you'll be able to access all of the sessions you couldn't attend. I know many of us wanted to move ourselves into 4 different places and 4 different breakout rooms at once. So you're not alone in that. And you can access all the wonderful information that happened, which is just fabulous. As we leave, I want to echo Anna's thoughts that this is a moment where we can move forward together. It takes all of our efforts, whether you're a self-advocate or a parent or caregiver, a medical professional, a funder, a policymaker, a community organization, whatever your role is, a healthcare plan, whatever your role is in helping children with complex medical needs have what they need to thrive. You're an integral piece of this system, and you're an integral piece of supporting all of our children and making California a place where children with complex medical needs and disabilities can access the services that they need so that they can thrive and their families can be supported. So just thank you so, so much for everything that you do. And this is a moment where we can all step forward together. It is just the beginning. Thank you for being here with us for the 2024 Health Summit. And I'm sure we will see each other again soon, hopefully in person and maybe in Sacramento or at your local office for your representatives. Take the information that you learned today and advocate locally and at the state and federal levels, and also in the systems that you work within, whether you're talking to your social worker or your case manager, or whether you are a social worker or case manager or provider. They're all moments to share about the struggles that we have and ways that all of these vitally important but very complex systems can better support children and youth with special healthcare needs. So thank you so much for being here today, and we will connect again soon.